and welcome to the Washington Medical Commission Patient-Focused Webinar Series. Today, as part of Patient Safety Awareness Week, we are discussing your rights as a patient. And I am joined today by Dr. Diana Curry. She's a WMC physician member, Melanie De Leon, WMC Executive Director, and Mahi Zur, WMC Equity and Social Justice Manager. Now, before I turn the webinar over, I would like to take care of a few housekeeping items. We encourage you to ask questions throughout the presentation, so look for the questions box on your webinar portal, and we'll do our best to address your questions toward the end of the presentation. We hope that you do not have any technical difficulties, but if you do, look for the help button on the webinar portal to get your issue worked out. We are recording this webinar, and the on-demand version and the slide deck will be available on our website within the next few days. Please feel free to share these resources with your colleagues, and we want our learning events to be as interactive as possible, especially during Patient Safety Awareness Week. So feel free to use our social media platforms to share what you have learned and keep the conversation going. Now, with all of that out of the way, I will turn it over.
Thank you. My name is Melanie De Leon. As Jimmy introduced, I am the Executive Director, and I want to talk a little bit about who the Medical Commission is. It is made up of 21 governor-appointed commissioners. There are 13 physicians altogether. 10 of those physicians come from 10 of the congressional districts across Washington state, and there are 3 at-large physicians. We have 2 physician assistants who can be appointed from anywhere in the state, and 6 public members. The commissioners are appointed to a term of 4 years, and they can reapply and get reappointed for another 4-year term. So altogether, they can serve 8 years as a commissioner. I also have the ability to appoint pro tem members. These are commissioners who have certain specialties that we need for case reviews, and I can appoint them for a total of 4 one-year terms. On the other side of the coin, there are also staff who support the mission and work of the commission, and there are about 57 staff members. And right now we work all across the state, but we are assigned to either the Tumwater office or the Spokane office. So that's a little bit about the commission. Next slide, please. Mahi, this is yours.
Good morning, everyone. My name is Mahi Zeru, and I am the Equity and Social Justice Manager here at the Commission. And we're all here today to discuss important things you need to know and understand to get the level of care you expect and deserve. Knowing your rights allows you to advocate for yourself and for your loved ones, and it also helps empower you to consider all your options and gives you the confidence to make the decisions, the best decisions for yourself. When you know your rights, you work hard to make sure they're protected. So health is a human right, and so you have a right to be treated with respect regardless of your race, sex, gender, color, religion, marital status, sexual orientation or identity, disability, or any other condition. And your provider cannot discriminate against you based on any of those above. And you also have a right to have your privacy protected. Your doctor just can't give out your status to your family members unless, of course, you give consent. And you also have a right to be treated in a clean and safe environment. So if you see your doctor touching you with the same glove they used to treat other patients, please speak up and remind them to change, please. And you also have a right to request a chaperone during your exam or decline treatment if that cannot be provided. So for cultural reasons, you may want a chaperone. And I am now reminding you that you are within your rights to request one. And you also have a right to discuss your health concerns and treatment plan with your provider. So if you speak the same language, yes, that's great. But if you speak American Sign Language or Arabic or any other language, you have a right to request interpretation, and your doctor has to provide you with a reasonable accommodation. So if you're making an appointment, make sure you arrange over the phone interpretation accommodations. And for smaller practices, your doctor's office will arrange a phone-based interpretation service, or for ASL, they can do a video remote interpretation for you to communicate. And for larger hospitals, they usually have contracts with interpretation services, so they're able to provide you during your visit, or it could be arranged prior to your visit. And it's also not a good idea to use family members to provide interpretation services, because family members might not understand the complex medical terms, or they may change the content of a difficult message, and they may relay the wrong information for cultural or other reasons. So you also might find it, too scary to tell the truth regarding your drinking habits or sexual activity or drug use. So it's definitely not a good, and it's also definitely not a good idea to use children, because children can be harmed by hearing complex medical findings, finding out your mom has a terminal illness or an STD, can cause undue stress and trauma for the child. So definitely avoid using family members. And most importantly, using untrained interpretation services decreases the quality of care. So it's best to just ask for a professional medical interpretation service. And you can also, since we're on communication, you should also discuss other things you might want accommodations for, so your doctor can address your concerns more reasonably. For example, if you're in recovery, tell your provider not to prescribe you any narcotic painkillers. And if you have PTSD from a sexual trauma, you can ask your provider to accommodate you by letting you know, to tell you when they're going to touch you or walk you through the procedure, so you're more aware of it. And it's also your right, you also have a right to be advised of alternative care options when certain treatments are no longer effective. And this is hard. This is like definitely a hard one, because ultimately it's your decision to make, and you have a right to choose the options you want to take. And one other right is also, one other right I think that touches on all of your patient rights is informed consent, which means you have a right to gather information on the status of your overall health, ask questions about your treatment options, and then make informed decision on what's best for you, even if it goes against your provider's recommendation. So I think that's a great one. And you also have a right to expect reasonable continuity of care, which means if your doctor moves to a different place, they must refer you to another provider, so you're taken care of. And you also have a right to refuse treatment, even if it's recommended by your practitioner. Even when it's medically indicated, some people may refuse to receive blood transfusions for whatever religious reasons, and others may decide they don't want to pursue the recommended treatment because it's too risky or expensive, or because even if the treatment's provided, the quality of life doesn't improve. So they might want to refuse treatment for those reasons. And you also have a right to access your records. So now with electronic medical record keeping, it's much easier. You're able to just download your entire chart into a PDF and have it accessible, but you're also entitled to a paper copy. And your health is just too important for you not to be involved and informed. Next slide, please. Patient responsibilities. So it is your responsibility to provide information. You and your family are responsible for providing accurate information that's based on your symptoms, or discuss past illness, hospitalizations, medications, surgeries, everything. It's your responsibility to provide that information so your doctor is able to treat you accordingly. And it's important not to hide anything from your doctor too. For example, if you're a transgender person, it's important for you to be able to trust your provider, tell them about the medicines you've taken in the past, the surgeries you've had, and if your provider knows what has happened to you in the past, they're able to give you the best treatment options there right now. So it's very important to do that. And asking questions about prevention, diagnostic tests, medication, how to manage your illness. Keep asking until you've received all satisfying, until you're definitely satisfied with your provider. From a personal experience, I worked really hard to avoid, reinforcing stereotypes and racist beliefs about, Black women being less compliant and loud by not asking any questions, or raising too many concerns. And that's something I want to tell people to avoid. Your health is way too important for you to not, be fully involved and informed. So please advocate for yourself, and trust your instinct too. So if you're feeling dismissed or not listened to, say something, and don't be shy about saying directly, to your provider, I don't think you're hearing my concerns. So do that, please. You're also responsible for meeting financial commitments. And I think patients are also responsible to find doctors they can trust, or trust to care for them. So do research your providers. Look at the reviews online and make a selection based on that. So there are many helpful resources out there. For instance, if you identify as LGBTQ, IA, use the Health Professionals Advancing Equality. So there is a provider directory that you can search for friendly practices that are committed to maintaining LGBTQIA identity. And if you're trans, you can use, there's also a directory for that. There's a World Professional Association for Transgender Health directory that has trans affirming providers on there. And if you're in a larger body, there's a review of providers out there. And the list is maintained by a website called Fat Friendly Health Providers. So you can also find providers that are willing to see you in that way. And if you prefer to have a Black women provider, you can search the Association of Black Women Physicians, or there's like an app now called Health in Our Hue. So you can find providers based on specialty too. So you can definitely find a provider you can trust. Now I will turn it over to Dr. Curry to talk about medical consent.
Hi, everyone. Hi, can you guys hear me? Yeah, okay. So let's talk about medical consent, which Mahi talked about a little bit, but I want to just go into the idea of shared decision making. So there's lots of historically models of consent. So it's the doctor telling you what to do, the sort of patriarchal. There's the sort of, here's your choices, you decide, I'm not going to lean you one way or the other. But really the most up-to-date and best way to do medical consent is with the shared decision-making model. And what that means is that it's the clinician has to help the patient get all the relevant information about the problem that they're having and all the different treatment options, the pros and cons associated with each option, and then really kind of let the patient decide what they want to do. But in terms of giving that information, it's not as easy as it sounds. So we have to take very technical, complicated, nuanced, factors into account. But it is our job to translate it into sort of layman's speech, right, into very easy ways to understand things. And I think what we've seen in the last 10 or 20 years as this model of consent has evolved is a plethora of educational materials out there. So back in the day, we used to send people CDs with videos. Now it's all online, you can stream it, but visual aids, diagrams, pamphlets, all of that type of thing is meant to get the information to you as the patient so that you can make the best decision for yourself. And as a physician, it's fine, like I can give my opinion, well, most people in this situation would probably do this, here's the expected outcomes, but here's the other 3 things that are reasonable too. So, we don't walk in your shoes, so you get to make that final decision with obviously hopefully some good guidance. And I will say that over the years, I've had plenty of patients that, they don't want to get treatment for whatever it is they're dealing with, even something like cancer, because they would rather spend time with their family. So one of the things that you can't put into an informed consent model is a person's values. Only a patient knows their values. I can't possibly describe all the different values out there and what's important to people, right? I can tell you the medical side of things, but when it comes to what a person values, that's something that really has to come from the patient. And so frequently patients and doctors have different values, and that's fine. A good doctor should respect that and go with it. There are doctors, though, who are uncomfortable with that or, don't understand it. And I'll just give an example to piggyback on what Mahi mentioned. I'm an OBGYN, so I've had lots of patients that have a lot of anemia and need surgery for that for whatever reason. But if I have a patient that's extremely anemic and needs major surgery like a hysterectomy to treat her bleeding problem, but she's a Jehovah's Witness and refuses a blood transfusion, I had to come to recognize that I would not be comfortable letting a patient die on my operating table. That's just not something I as a human could live with myself. So what I do is I then refer that patient to a physician who either shares that value or understands it or doesn't feel quite the way I do. So the discussion about values and what's important is obviously crucial for patients, but there's also a little bit of the doctor there too, right? So we are humans also. So it's a communication, it's a two-way street. And I think that that's really important for everyone to understand. Okay, let's go to the next slide. Who's doing slides, Jimmy? Yeah, there we go. Okay. So I just wanted to go over medications because I think this is one of the most common things that we do, right? We prescribe medications. And it is very important for providers to explain why a medication is being offered and what the goals of treatment are. And what are the pros and cons if that medication isn't taken? Additionally, what are the non-medical alternatives or other medications that exist that might be used if appropriate for that problem the patient's having? I think that it's too easy to say, well, your insurance covers this blood pressure medication, therefore I'm going to prescribe this. I mean, that's fine, that's the reality. But the bigger picture is for blood pressure, there might be 4 different medications or other alternatives like diet, exercise, lifestyle changes that we are, as clinicians, should be explaining to you as a patient so that you can make an informed decision about what you want to use. Now, you may decide that you want medication XYZ and your insurance doesn't cover it. It only covers medication, ABC. That's your choice then. I can prescribe either. You may have to pay $100 a month for one and no money per month for the other, but that's a choice. That's a choice that everybody gets to make. So it is important to go over all of that. Common side effects usually are discussed with the doctor who's prescribing the medication, as well as common medication interactions, or if the physician knows that you're on a particular other medication that there's going to be an interaction, they should talk about that with you. I will say though, in the last 10 or 20 years, again, the explosion of new medications is ridiculous. Like it's beyond something that any human brain can manage to remember. So increasingly, there's a partnership between physicians and pharmacists, and every medication should come with a long, detailed handout from your pharmacist with all of the potential interactions and side effects. And when you go pick up your medication, most pharmacists, they will have you step aside, and then, the person sort of getting your medication for you, the pharmacy tech, will say, okay, now you're going to have your consult with a pharmacist. That is really important. I think a lot of people don't realize that we in the medical system depend on that pharmacist to have the most up-to-date, extensive knowledge of each medication and to discuss it with the patient who's getting it. So it is very important to not totally depend on your doctor to tell you all the side effects and interactions, but also look to your pharmacist and the handouts that they give you and that opportunity for the pharmacy consult. Another thing to know about is proper disposal of unused medications. So I will say that in Washington, the levels of antibiotics, of opiates, of digoxin, of all kinds of things that are in our fish, our local fish and waters, is kind of scary. So it is really important not to just flush your pills down the toilet, but every pharmacy should have a way to tell you about how to dispose of medications. Often they have a drop-off site, that type of thing. And then Mahi already touched on this, so I won't belabor the point, but being able to refuse treatment is certainly within a patient's rights. And there are cases where no big deal, you don't want to get this treated, it's not life-threatening, that's fine, that's totally your choice. But there are other cases where it is a more sort of life-threatening situation. And so it is really incumbent upon the physician when we're having that conversation with the patient to find out why they don't want to take it or what their concerns are. And in order for us to document, so you will see in your medical record, discuss the risks and benefits. Patient has declined this medicine at this time. Patient's aware of the consequences of that, whatever those may be. And you will actually, in the most extreme situations, have physicians who are so uncomfortable taking care of a patient who's refusing treatment because that means the patient is probably going to die or something terrible is going to happen. And again, kind of like me not wanting to operate on that patient who's going to die on the table because I can't give her a transfusion and I'm not kind of okay with that or comfortable with that as a human. There are doctors who may choose not to treat certain patients who don't want to follow the treatment plan or any treatment plan that the doctor feels comfortable with, because again, you have a human behind that MD. There's a human who has to also feel like they're in a productive relationship. So sometimes I have had patients get upset when I ask them why they don't want to take a medication or do whatever. And I say, well, I need to understand it, but also I need to document it. And I need to make sure that if there is a reason that something that I can't address, right, it's not something within my capacity, my scope of practice, that I can get you to somebody who might be better suited for you. So I think there's lots of reasons why we want to know that. But I have had patients push back when I've said, patient declines medication. That sounds strong, declines. It's a medical word we use all the time. But that's really why we're doing it. We're trying to understand better and how to help better. Okay, I think we're on to the next slide.
Okay. When should you seek a second opinion? So going back to my own experience, I am so hesitant to seek second opinion because I wanted to be, the good patient who only listens and doesn't challenge, my providers. So, but then again, the only person who will fight for us is us. So when should you seek a second opinion? So in addition to the list here, I wanted to seek a second opinion when I was not convinced all the way, and when I have not, received a satisfying explanation for my condition. And if you sense any kind of doubt, and especially if the problem is outside the scope of, your primary care physician, definitely seek second opinion. And, I now, from my own personal experience, I now encourage women to feel confident in speaking their minds and asking questions, they feel are necessary to get a second opinion. So, and I always wonder how doctors feel about second opinions. So I will invite Dr. Curry back to discuss the value of a second opinion.
Right. So I personally love second opinions. I love to be the recipient and be the person who's giving the second opinion, but also sending my patients for them. I don't think that patients should feel worried about getting a second opinion. I know that even my own mother will say, oh, no, I would never go do that because, my doctor will find out and they won't like me, and, that type of thing. And that's not really true. And if that is true, that doctor is probably not right for you. So yes, definitely get second opinions, get third opinions. It is very important to hear what you need to hear to understand what's going on with your own body. And even though I may explain something to Mahi about her body, about something I'm taking care of, I may not explain it in a way that she totally gets. Like we just don't quite speak the same, use the same frame of reference, whatever it is, it doesn't matter. But another doctor might actually explain that same thing in a medically same way, but in a sort of layperson's way that's different. They connect better. So yes, get a second opinion by all means, get a third.
Thank you for validating that, Dr. Curry, really appreciate it. So I know Dr. Curry touched on the value of a second opinion. So if you're, if you have a complex medical condition, she really affirmed my belief to get a second opinion again, because again, maybe the doctor that I found first was not best fit to address my condition. It might be out of their scope, but to just even validate the treatment option, I think it's also there is a value in second opinions. Next slide, please.
Oh, Mahi, just mention
Yes.
about medical records. Yeah, if you're going for a second opinion, bring all your records.
Okay.
And I'll just say one more thing about records. I have been the recipient of many second opinion requests in my career, and sometimes patients will come with 200, 300, 400 pages of records. So try not to get mad at your doctor if they haven't had a chance to read them all beforehand. Just go with the flow and work with the person. But it is really important to know what's happened before and what all the results are that somebody's had in the previous workup. And sometimes the patient telling me what their x-ray showed or their CAT scan showed is very different from what I read when I read the report, right? So it's that discrepancy between sort of the medical terminology and understanding of words that may be shared words in common but have different meanings between patients and physicians. So.
Question for you, Dr. Curry. Aren't the second opinions supposed to start from the beginning? Is it supposed to start from the beginning or from where the other doctor left off?
Usually, if it's a complex medical condition, Mahi, and that's a great question, we want all of the data that's been collected. So, for example, if somebody's had x-rays, CAT scans, blood tests, things like that, most insurance companies are not going to pay for you to get another CAT scan 2 months later just because you're going for a second opinion. So all the imaging, all of the blood tests, all of that sort of thing, any in-office tests or biopsies, pathology reports. So I don't necessarily need to see the other doctor's notes, but all of the primary data is really important. And frequently that's found within the entire medical record. So often you get the notes as well. And as a specialist, you will not necessarily look at the notes that closely. It's more you're looking at the primary data. Although it can help in complex cases to see what the patient's been told before or what the doctor's recommended before, because then you have a shared understanding of where that patient is starting out in terms of their knowledge. Like they've heard these terms before. They've heard this, for example, type of chemotherapy or type of surgery before.
Thank you.
So the next matter we want to talk about is how to prepare for a visit when you are going to see a physician. And of course, it depends on whether you've seen this physician before and they know a little bit about you, or if this is a brand new physician. But either way, I think it's really good to bring a notebook or something with you and kind of jot down the questions that you want to cover during that visit. Sometimes, things you'll start talking about a pain that you're having, and the conversation will veer off and never get back to some of the questions that you really wanted to have answered at that visit. And doctor's time is very precious. So they can't just sit there and chat with you for hours and hours. Usually you have about 10 or 15 minutes to kind of talk, and then they do, their examination, and then you kind of wrap it up and you leave. And you need to make sure that you ask the questions that are most pertinent to the issues that you want to discuss at that time, and kind of prioritize it. You don't want to come in with 15 issues that you have. You want to zero in on the ones that are the biggest ones for you, maybe the most pain or the most life-threatening. And again, I'm a lay person, so I can, I have issues that crop up on the way to the doctor's office that I wasn't going to talk about, and then all of a sudden, my knee is hurting or something. So make sure that you kind of prioritize and stick with those priorities during your visit, because you can always schedule another visit down the line, or maybe do a telemedicine consult. And we'll talk about telemedicine here in a couple of slides. But telemedicine is a really good way sometimes to talk about those issues that you can't get to at a visit. Make sure that you know what your current medications are. For example, I'm on a medication for high blood pressure. And because I've had some sensitivities in the past, I've changed many times of that, whatever that high blood pressure medication is. And sometimes I can't remember what I'm currently taking. So it's nice if you bring a list of the medications that you're taking so that they know what you're on now, and if, if they're going to prescribe you anything, to make sure that they're not going to prescribe something that doesn't work well with your current medications. And again, as a patient, I thought that all doctors' offices were connected electronically in some sort of internet of medical facilities and doctor offices, and that's not true. They have electronic medical records, but they're not all connected together, so that when you go from one doctor's office to another, they may not be able to see your medical records. So although we think as patients you can go in there and they can put your name in their system and pop up all of your medications, they might not be able to do that at a moment's notice. So make sure that you bring a list of your current medications. Also, any kind of supplements that you might take, for example, vitamins or other natural kind of supplements, those things also can interact with prescriptions, and you might not think, that the, I don't know, whatever some sort of natural supplement you take might be impacted by a medication. Also know your family history if possible. And again, I wasn't lucky enough to have the talk from my parents. They passed away when I was in my early 30s. And so I don't really know what my family history is for medical issues. And so I can only sort of guess. And so I told my son, who is an older adult child, someday we're going to have that talk, and you need to have that talk with your children if you haven't already, so that they know that, something might run in your family, or that you have issues that your parents didn't have. So if you have that kind of family history, again, make notes of that and tell your physician, because they usually do ask if you have history of diabetes or high blood pressure or whatever in your family. So it's nice to be able to say, yes, I know, or I haven't a clue. Hopefully you know that. And then know your past medical and surgical history. Again, I had an accident skiing many years ago, and it tweaked my knee. And I have to remember, was it my left knee or my right knee? And you think, well, you're never going to forget that. But, fast forward 20 years and you forget which exact knee it was. You just remember, you had a skiing accident. So it's nice if you know what that history is. And again, I had that knee problem before there were electronic medical records, and my doctor at that time has retired and gone out of business, and my medical records are no longer available for that particular issue. So during your visit, tell your doctor at the beginning, what you want to discuss during that time. They usually say, okay, why are you here to see me? So again, have a couple of things that you want to talk about, and say, are we going to have enough time to talk about this? If it's something where they need to get an x-ray or something, you may not be able to spend as much time talking because you have to go get a blood test or whatever. And then if you can't discuss it to your liking, perhaps you can negotiate how these other concerns will be addressed in the future, and then make a follow-on appointment to discuss those issues at the next visit. Next slide, please. So again, how to prepare for your visit is, if you have new symptoms, kind of, when it happens, try to jot down, when did this happen? Was it yesterday? Was it 3 days ago? And doctors are really good about asking you, how long have you had this pain? And you're like, well, I don't know, it was a couple of days ago. And a couple of days can mean a week, it can mean actually 2 days, or it can mean it happened this morning. We're very vague about when we say a couple of days ago. So kind of try to pinpoint when you started having the symptoms. And then, is there anything that you do that makes it feel better or makes it feel worse? For example, if you're having stomach issues, does it happen after you eat something spicy? Does it feel better when you drink milk? Is there anything that you're doing sort of in your own, I call it mom medication, at your home, to make it feel better or worse, icing it or putting heat on it, those kinds of things. And then they always ask you if you have pain, on a scale of 1 to 10. And I'm like, I don't know what a 1 is. I'm thinking 10 would be really horrible, and I don't think I've ever had a 10. So, I'm always kind of 6 or 7. I don't know. And I don't know what that means to a doctor. Maybe Dr. Curry can chime in, but I don't know, maybe 5 and below is kind of my normal, I wake up with aches and pains every day and I just live with them. And so usually 7 or 8 if it's kind of bothering me a lot. But again, I think that scale of 1 to 10 is kind of very subjective. So give it your best guess. And, sometimes they'll try to help you hone in on the pain level. So maybe the doctor can kind of help you. Well, what does 10 mean? But again, I think I've never had a 10, so I don't know. And I've had child labor. I don't know that was a 10.
Yeah, Melanie, I think if you've had a baby, it's a 10.
But anyways, so just try to, be as good as you can about 1 to 10, any associated symptoms, with your knee pain. Does your hip also hurt? Whatever. Does your side hurt? That, they will ask you a bunch of questions, but kind of know your body when you walk in. And then other things you've already tried, again, heat, ice, those kinds of things, because they will ask you. And other tests that your doctors that you've seen bring kind of a written timeline. Again, the doctor's not going to know everything about you, and they're not going to have 3 days to review your medical chart before you walk in. So they just don't have that time, and that's just how it is. So kind of bring your timeline and be prepared to talk about that. And again, although Mahi said, bringing a family member might not always be the best way to go, sometimes it's helpful, especially if the patient is, is an older person. Heck, I'm the older person now, but they might not remember things, or they might not know all of their medications. Consider bringing someone who can at least say, well, this is what mom is on, and this is what we've done so far, or dad or uncle or whoever it might be. So, and again, so just kind of take responsibility for knowing yourself and your pain and the symptoms before you come to a doctor's visit. It just makes it so much better for you and the physician. Next slide, please. So I didn't realize this, but Dr. Curry informed me that most insurance companies will pay for a wellness visit a year. And a wellness visit is when you go and the doctor kind of, takes a look under the hood and, kicks the tires, and it's sort of prevention and screening. And so a wellness visit is not the time to bring up a bunch of symptoms or concerns or problems. It's really just, they take your blood pressure, they do, they listen to your chest and look in your ears and all of those kinds of things. Just, it's very, very preventative to make sure that you've had all of your, your screenings, your immunizations, and those kinds of things. So routine preventative health is very important, because you want to make sure that, from like today, I'm healthy, and then if things happen, you kind of have a good starting point on when things kind of went a different direction. And it's just really important to make sure that you have your immunizations and all of your other types of screenings. As a woman, we have a lot of screenings that we do annually, or every now and again. Colonoscopies, they start those a bit younger. Mammograms, which I've done, every year since the beginning of time, it seems like. So just make sure that, you're getting those wellness types of screenings done, so that, when something goes south, you have a good date. Well, it was fine as of 3 weeks ago, and now it's starting to kind of go south. Next slide, please. So this is where Dr. Curry is going to help talk a little bit about what to expect for a telemedicine visit. And I can kind of give you an idea from the patient's point of view. And there are certain things that I don't think are super appropriate for telemedicine, but there are a lot of things, and Dr. Curry, hopefully you can chime in here, where a telemedicine visit is very appropriate.
Right. So I think we've all seen in the pandemic that telehealth is being used more and more. And it's still a little bit uncertain what sort of percentage of visits are appropriate for telehealth, though most organizations are sort of settling down somewhere in the 20 to 30% range, depending on the specialty or the type of visit. So it's not the dominant mode, but it's actually a pretty large part of our practice and will probably remain so going forward. So it can be effective for new diagnoses, although often telehealth is more effective for follow-up on a diagnosis or for monitoring current kind of chronic conditions such as diabetes and high blood pressure or medication management. There are some the sort of more intellectual, we call them specialties, for example, maybe endocrinology, where the doctor really can just ask you about your symptoms and get your blood tests and make a diagnosis, where they don't really need to listen to your heart and lungs as much. There are other specialties where, for example, OBGYN, where it's kind of hard to do the exam through the computer. So it just depends. In terms of the type, what to expect in terms of the standards, the exact same standards apply to both in-person and telehealth visits. From the point of view of the physician, my obligation for documentation, for everything is the same. So it should not be a degraded or less than form of care. Interpreters should be provided if needed. And in fact, I have found that with telehealth over Zoom or some format like this, I can have an ASL interpreter, my patient, me, I can have whatever language interpreter. So you can do all the same things over the computer that you can in person. Frequently, nurses will call, or some staff member from the doctor's clinic will call ahead of time to confirm basic information and to make sure that the patient can, get on the computer and access their appointment. That's pretty common. That's less common nowadays as people have more experience with this, but it still does happen. One of the things that we typically like to get is, blood pressure, height, weight, temperature, pulse, etc., when everybody goes to the doctor. And almost every specialty, it feels like, does that. Obviously, in telehealth, we can't do that, but remote monitoring devices are becoming much more common. Many people do have home blood pressure cuffs, and they certainly have like a bathroom scale. They maybe know how to take their pulse, etc. So frequently doctors will ask, or the nurse calling ahead of time will ask the patient who's going to have the telehealth visit to try to get some of that data to give to the doctor so that we can keep track of it and put it into our note and really monitor. Again, if we're monitoring medication management, diabetes, if you're a diabetic, you're doing your own blood sugars. Well, pretty much this day and age, with all the new wearables out there, people can monitor a lot more than just their blood sugar. And I think that's the way that we're going in medicine. Let's see, the visits that involve medication management are very important to have the medications and even the bottles kind of right there, especially for people that are on a lot of different medications. It's not uncommon for us to ask, so do you take the hypertension dose in the morning or in the evening? And they're like, oh yeah, the blue pill I take in the morning and evening. Well, as a physician, I don't know the colors of any of the pills or the sizes or shapes. And even though we all identify our own medications that way, I do the same thing. I take my white pill this time of day. I take my yellow one that time of day. For communication purposes, it's good to have all the bottles there ready to go. And then more and more people are talking about and exploring how to do a limited visual exam. So doctors will ask a patient, particularly older people, to walk and watch them walk through the computer, or to follow certain commands, or if it's a rash, for example, teledermatology is huge. Show me the rash that's on your arm so I can see that. Even post-op appointments can be done by telehealth. So I work in a sort of rural adjacent area. I have patients that drive 2, sometimes 3 hours to come see me. When they're post-op at home, they may not want to drive all the way back a week later, but I can have them hold the computer up to their stomach and show me their incision and take their own temperature at home, and I can basically get all the information I need to know whether or not they're doing well, and possibly therefore avoid a trip into my office. Especially with gas prices these days. So again, telehealth visits have a really important role to play. They are not the be all and end all though. And I will say that patients do sometimes get frustrated that they can't have their cold or their URI or their whatever bronchitis, et cetera, a visit done through telehealth. And there are limits to what we can do. And I think for individual doctors, those limits are, here, some are here, some are here. Some people are really not comfortable diagnosing somebody without that in-person visit, without laying on of hands. So again, respecting the physician's need to see you in the office versus the convenience of having that telehealth visit, there's a balance. But it's here to stay as far as I'm concerned. I hope, as long as insurance covers it. Okay, next slide.
So again, you need to take charge of your own health care. It's pretty much, you are living in your body and only you can figure out whether it's working right or it isn't working right. And one of the things that is very important is for you to keep your own personal health file. There is that electronic medical record, but again, I was in the military for many years, and I remember at the end of every duty station when I was leaving, I would go into the hospital and they would give me my file and I would hand carry it to the next hospital facility. And again, as I said before, not every doctor's office is connected electronically. And so the doctor that you have doing something else may not be able to interact with the doctor that you're seeing now. And so when you go to a new doctor, it's really nice if you have a complete copy of your health file, maybe not back since birth, but the last 5 or 10 years, or maybe you had something happen, that was catastrophic in your life health-wise, and from that point forward. But it's important for you to make sure that you have any kind of significant test results, your x-rays, your blood tests. I always keep a copy of my mammogram results to make sure that I know what those are and that I have, my negative one going forward so I can see where things have changed. Keep the names and addresses of your past clinicians. Doctors retire, they move away, they're just like you, life happens, and maybe, they're an older physician and they want to move on. And so they're only obligated to keep your records available for you to provide to your next doctor for so many years. So don't think that they're going to be holding your records in their garage forever and a day. That's not how it works. So listen of your past clinicians is also very helpful. Any kind of pathology reports, biopsies, those kinds of things. Operative notes, I've never been operated on, but if I had them, I would keep them. And discharge summaries from ERs or hospitalizations. When you go to your physician visit, they always give you that after visit summary. I keep those as well because it always has a lot of good information about the prescriptions they're giving you, the medications, kind of things you should do. If you have any physical therapy, they'll tell you. There is usually pictures about how to do the leg lifts or whatever it is you're supposed to do, and keep those handy. Because again, you're going to forget what they said. Was it this way or that way? And it's a nice instant place to go, kind of your own health library. Also, keep a file for your child if they're not of an adult age. And I'll be honest with you, I think actually keeping records of a child between 16 and 25 is not a bad idea, because during those ages, even though they're adults, they really don't think like an adult, and they don't keep records, and they think they're immortal. So I would keep records kind of until maybe they're 25 or 26 years old. Maybe that's too old, but that's my own personal opinion, not the opinion of the medical commission. And then again, as I said before, institutions don't always have ways to share information between physicians, especially if you're going from a physician that is either retiring or that moved away, or that you're just changing physicians to a new physician. They're not going to get access to your records. You have to sign an authorization allowing them to have access to your records. And it's just easier for you to bring your records with you than to try to have the doctor's office contact the physician that is either retired or moved away and get a copy of your records. So again, being informed will give you better results in the long run. So, keep a copy of your records, and then it's nice if you can provide those to the physician if you're going to a new physician over time. Next slide, please.
Melanie, I just want to piggyback on one thing which we said at our last webinar on the Healthcare 101, but that it is important to know as a patient that you have a right by law to get a copy of all your records. What is not legislated is that your doctor has to send those records to another doctor. So yes, you have to sign the authorization for that to happen, but there's no rule that says that has to happen. And so in a busy practice where, it takes 5 minutes or 10 minutes to pull all those records and scan them in or fax them or whatever it is to get them to a new doctor, that's uncompensated time. That's, some staff member has to do that. And, occasionally those things those fall through the cracks. However, your doctor is obligated to give your records to you, which is why I've always encouraged people to get their own copies.
And as a caveat to that, they can charge you for giving you a copy of your records, just FYI. Thank you. Again, this is the next slide. This is for you, Mahi.
Okay. So just to recap what we've just discussed so far, the patient-doctor communication is a two-way street. And as Dr. Curry stated earlier, doctors are human with feelings, so treat them as you want to be treated. Find a provider you can trust that gives you a sense of safety and validation. And also the success of the appointment is collaboration, and it requires contributions from both the provider and the patient. So share your needs regarding interpretation or special accommodations, such as trauma that might impact your care. And Melanie also talked about how to prepare for a visit with a list of questions, so you both know what's on the agenda. And the bottom line here is that the providers are there to help you feel better, but they're under a lot of stress and time pressure, and add staffing shortages and the pandemic pressure now. So as a patient, being prepared allows you to advocate for yourself and get the most out of your visit. So you do everything right, and say you do everything right and you feel something is still not right and you're not satisfied and you suspect that a medical professional is being biased against you, or has discriminatory practices, or isn't treat you the way you deserve or the way you expect, with respect, find another provider, and also file a complaint with the medical commission. And that concludes our presentation, and we can now open it up for questions. Thank you.
So I hope everyone will join me in a virtual round of applause for our panel. Thank you so much for a wonderful presentation. Attendees, you can use the question box to ask your questions. And while I give you all a moment to type those in, I want to remind everyone that if you're interested in how you can reliably research your provider, we are having another webinar tomorrow, the 16th at 4 p.m. And it's going to go over how to use the provider credential search, what websites are more reliable than others. So please feel free to join us if you are interested in that topic. So while we give everyone another minute to type in questions, are there any parting thoughts from the panel?
I would just say that, being a patient has its responsibilities, just like being a provider has responsibilities. And so, come informed. That doesn't mean that you have to Google every thing that you think is wrong with you, because I've Googled stuff and I have all of the symptoms of everything. And so, that only provides you with maybe kind of an idea of what the issues are. But physicians are there to help you, and they just want to talk to you and find out what's going on and be as truthful as possible. Even though you might not want to talk about how much wine you have or whatever, but still be as truthful as possible, because they can only work with the information that they have. They can do tests, but again, a lot of the information comes from you as the patient, and the test isn't going to give them that information. So just be open to that.
Marilyn, you have your hand raised, and I've unmuted you if you want to ask your question. We can't hear you if you're talking, so double check you're not self-muted. Okay, well, I still can't hear you, but if you want to write in to medical.speakers or type your question, I will get you, I'll follow up with that question. Well, I would like to thank my panel again for presenting this valuable information, and thank you everyone for attending. The presentation slides and the recording will be available on our website within the next day or so. And thank you. Have a wonderful week, and remember to take care of yourselves.
Bye.
Bye. Thank you all.
By the way, can you